And I will go ahead and get started. So thank you for joining our Strengthening Early Childhood Systems Building webinar. I will be your host today. My name is Erica Figueroa. I am a research project manager at the Center for Public Partnership and Research. And I will also be your main presenter today. We will be looking at the draft of the All In for Kansas Kids strategic plan. So just a couple of housekeeping pieces first. So just to remind everyone of the webinar cadence, our webinars were held on the second Wednesday of the month. So we have March 13th today is our webinar, and then our next will be April 10th. Please ensure that you are signed up to receive our All In for Cans e-newsletters that go out weekly. And the presentation today, as I said earlier, is our draft of the 2024 All In for Kansas Kids strategic plan. And then after that, we will be going over some early childhood system updates. I'd also like to introduce my colleague, Lindsay O'Ryan. She will be dropping in any needed links into the chat. And she will also be monitoring the chat for any questions that you all may have. And so with that, we will go ahead and get started. So we will, as I said, be talking about the strategic plan today. So to provide a little bit of context, our first strategic planning grant came in 2019. As part of this required a statewide needs assessment. This is when the All In for Kansas Kids brand was launched. And that final strategic plan was sent out in April 2020. Obviously, everyone knows that was a time where pandemic happened and everybody's worlds kind of changed. So we have learned a lot since then. We have through 2020 to 2024 got a PDG implementation grant to support some of the planning activities that happened in that strategic plan. And then now we currently have another planning grant. So out of that requirement is another needs assessment and an update to our current strategic plan. This is, as it was in 2019, has been a large collaborative effort between 4 of the state agencies, the Cabinet, KSDE, KDHE, and DCF, as well as many other community partners, organizations, and programs yourself to provide feedback. Process and timeline. So just to give you an update around what the current timeline is, the updated statewide needs assessment, the writing and collection happened all in 2023 and is available now on the Children's Cabinet website. So if you are interested in seeing what that current updated needs assessment looks like, that is available through the Children's Cabinet website. The new 5-year All In for Kansas Kids strategic plan is happening currently. It will span from 2024 to 2028. The evaluation of the old plan and the initial writing happened last fall and winter. And then this winter and spring, as I am doing currently, we are doing public engagement sessions to ensure that individuals see themselves in the plan and that they have the ability to provide feedback. And then the final finalization and the presentation of that plan will happen in late summer of this summer 2024. To give a little bit of context as to what the purpose of the plan is, the plan really is to provide a North Star for communities, for programs, organizations, and state agencies to ensure that we're kind of all rowing in the same direction, to ensure that we're all moving towards those same goals for our early childhood system and early childhood ecosystem in Kansas, really helping as that guide for decision making. This is not a funded initiative, but more of a guiding document. The document structure is broken into 3 parts that we call pillars. Those pillars do mirror what was seen in the needs assessment. Those pillars are the ecosystem, the workforce, and then children and families. From there, each pillar has a number of goals. Those goals are objectives that we would like to see, specific visions for within those pillars and kind of the larger buckets. And then underneath are going to be, those goals are going to be actions. And these are detailed steps that we would like to take to help achieve those particular goals. And then under that is going to be those measures of success. So those are going to be, how are we going to quantify, how do we operationalize and show progress that is being made towards those goals. As I go through the plan with you today, I would love for you all to keep these guiding questions in mind. What are actions that could be used to achieve the goals? Are there gaps? Are there pieces that we are missing that you yourself, your organization, or your community is working towards? If so, that's great. We really want to know what those gaps are. Where do you see yourself and your work in the strategic plan? If you don't, that's also really good feedback for us to know. And then where do you see the children and the families that you work with in the strategic plan? Again, if you don't see them in this plan, that's good information for us to know. What we will do today is I will go through each of the pillars and the goals, provide 1 or 2 examples of actions for each of those goals. And then I will do a demonstration as to how to navigate to the feedback website for everyone. And then from there, we will go ahead and do the early childhood updates. But today, I really just want to walk through the plan with you to provide some context and then allow you to provide feedback in the survey and in that we are going to show you how to go ahead and do that today. The survey and the feedback can be as global as you would like, kind of talking about the overall tone, structure, or really as detailed as you like. So word changes, additions to actions that you feel may be missing. And that is all really wonderful feedback that we would love to hear. So from there, I will begin with the ecosystem pillar. So the ecosystem pillar is the first goal is strengthening the continuum of early childhood services through widespread collaboration across state and local partners. This is really looking at how are the different players within the early childhood ecosystem collaborating, and what does the governance look like so that we can go ahead and make changes that help to better serve the children and families that we work with. Some examples of that is to ensure all early childhood funding made by state agencies are mapped to the strategic plan and goals, to improve consistency of expectations related to early childhood services, and to help remove administration inefficiencies. The next goal is to connect families to the right services at the right time. Through a comprehensive network of resources and services. So this really is about how are our families navigating the early childhood ecosystem. Some examples of actions for this is increasing the uptake of 1-800-CHILDREN as a trusted referral source, and capturing bright spots and lessons learned across the ecosystem for local resource and referral networks, and spreading those so that other communities can ensure that they are learning from their peers. And I'm just providing one or two examples of each of these goals. There are quite a few more in the actual plan that you will see when you navigate and are able to read that whole plan. The next goal is to measure impact across the continuum of early childhood services over time and use data to make changes that reduce disparities and improve outcomes for children. This goal really is around how are we aligning data collection and how are we utilizing available data to show the impact that we are making, and are we collecting the right things? So part of this is to adopt quality indicators for specific outcome areas like family engagement, healthy development, maternal and child health resources, and then looking at data longitudinally over time. The next goal, goal number 4, is to promote agreements between public and private sectors to expand early childhood supports. So this really is talking about investments in the early childhood ecosystem and community-driven partnerships. So develop and publicize different fiscal approaches to supporting private sector or supporting childcare for private sectors. So is it getting businesses involved? Is it getting philanthropy involved? Publicize family-friendly workplaces, workplace resources, and how can we help to promote some of those resources to employers for them to better support families. Our next goal is supporting policies and efforts to increase capacity, enhance quality, improve access to resources, and contribute to the economic security of families. So an example of these for the actions are making it easier for families to access federal and state resources that address basic needs, leveraging state matching funds to ensure maximum drawdown of federal resources for the continuum of for the early childhood continuum of services, and analyzing policies to help ensure that we are getting rid of administrative burden. Our next goal is strengthening existing tools and creating new resources that help families make an informed decision and experience seamless transitions in support of their child's interests, healthy social development, and academic potential. Examples of actions of this are promote the use of the ASQ statewide online system, recognize the perinatal period as a significant transition period and an opportunity to introduce families to services like WIC, Medicaid, home visiting, the Dolly Parton Imagination Library, and promote inclusive practices that provide accompanying supports for children with or at risk for developmental delays and special healthcare needs for the ages birth to 5, so that these children can participate in regular early childhood programming together with their typically developing peers. So that was the ecosystem the ecosystem pillar. I'm going to pause there to see if anybody has any thoughts or comments or questions. And Lindsay, I will rely on you to see if anything comes through the chat. Wonderful. So not hearing any thoughts or questions, I will continue on with our workforce pillar. Our workforce pillar, goal 1, is support the strategies to increase the overall compensation of early childhood professionals to improve the financial sustainability of programs. This really has to do with compensation of the early childhood workforce and improved financial sustainability. So how can we make the early childhood services model so that they are financially stable? When I talk about the early childhood workforce, this really is comprehensive of anybody that is helping children and families. So childcare providers, early intervention specialists, home visiting, really wanting this section to speak to all of those different groups. Example actions of this is to support policies that increase availability of benefit packages. For example, paid leave, health insurance for early childhood professionals. And then another would be to establish a compensation ladder with a competitive wage floor and financial incentives to recruit, retain, and support advancement of a diverse workforce. Goal 2 is to build workforce capacity to provide high quality early childhood services. This really is about increasing our a number of early childhood professionals, and also about retaining those early childhood professionals that are already in the workforce. Part of this actions would be document and distribute detailed information on effective models for recruiting new professionals. For example, high school career exploration courses, apprenticeship programs, and returnships, as well as coordinating with the Department of Commerce to ensure economic development projects are efficiently supported in planning for childcare needs. Goal 3 is support early childhood professionals to help them reach their professional and development goals. So this, again, as it says in the goal, really has to do with that professional development. Are professionals receiving the development that they would like? Are we making it accessible for them? So examples of this are executing the early childhood career pathways implementation plan to ensuring alignment with the core competencies and higher education, convene a working group to explore and recommend integration opportunities between childcare and home visiting, visiting professional development services. Number 4 is support high quality programming and resources for children in all birth to age 5 environments so they can reach appropriate developmental goals. So this really is about quality of experiences and quality of environment. So example actions of this is to help early childhood programs upgrade facilities, materials, curriculums to ensure that high quality environment and meet the needs of all of the young children, especially those, or specifically those, particularly those with special health care needs. Expand links to quality statewide to ensure consistent high quality and early childhood environments. So those are our goals within the workforce pillar. I will pause here for a moment to see if anyone has any thoughts and reactions before we move on to our children and families pillar. Wonderful. Not hearing any or seeing any in the chat, I will go ahead and start our children and families pillar. Our goal 1 for our children and families pillar is to engage families in experience to both learn and contribute while creating new opportunities to help shape the early childhood ecosystem. So this really is around family voice and knowledge, but also around empowerment for families to become engaged to shape the systems that are providing for them. So example actions of this is to provide connections and resources to family leaders seeking increased advocacy, knowledge, or leadership training. Prepare state agencies, coalitions, and work groups to incorporate family engagement best practices and equip and train families to meaningfully engage in the early childhood initiatives in that they are using. Our next goal is build awareness of services available to families, help make informed decisions in support of their child's interests, healthy development, and learning. So this really is around ensuring that families have all of the necessary information for them to be able to make that family choice and to make the choice that's best for them and their children. Distribute information about healthy development and screening in places across the continuum of services, including family resource centers and partners of the broader ecosystem like public spaces, physical health and settings, and elementary schools. Another example of an action is equipped community-based facilities to include critical information of available resources such as 1-800-CHILDREN. Our next family and child goal is number 3, is to improve child well-being by increasing access to the continuum of services that prioritize safe, nurturing parent-caregiver relationships and strong families. So examples of this for actions are ensure families in need can access concrete economic supports to meet their basic needs, like food, shelter, broadband supports, and newborn supports. Another example is collaborate across community services to develop tiered response approaches that can help to de-escalate an emerging family crisis. And then also streamline agreements between KDHE and appropriate entities to support automatic enrollment or referral to eligible services when families can sign up for WIC. And likewise, automatic referrals the other direction. Goal 4 is prioritize the mental health of families by offering accessible multi-generational services to both children and parent/caregivers. So this really has a lot to do with the mental and behavioral health of both families, so the caregivers and parents, as well as the children themselves. So example actions of this is to support the holistic recovery of children that have lived through natural disasters by addressing physical and mental health needs, expand mental health services to provide to improve outcomes for new parents through initiatives that support their unique needs during the postpartum transition period, and to better help prepare providers across the continuum to better recognize and efficiently make referrals related to parental mental health. And our final goal is to ensure families experience trusted interactions across the continuum of early childhood services. So this has a lot to do with ensuring that we can meet the unique needs of each family, since many families will have a kind of different constellation of services that they will need as they navigate our early childhood ecosystem. So example actions of this are train early childhood professionals to better understand and identify ways to prioritize or to provide linguistically and diverse ability appropriate experiences, communicate in ways that are responsive to unique family needs to build trust between professionals and families, and work with families to understand and leverage existing trusted resources in the community. So from there, that is our kind of overall view of the goals within the current draft of the strategic plan. From there, I will go ahead and show you how to navigate to our public feedback input form. So I will stop sharing for a moment. And if anyone has any thoughts or questions about the plan overall while I navigate to the feedback form, please feel free to share those now. All right, so this, when you get to the public feedback form, this is what you will see. This is on the Children's Cabinet website. Here, it's just introduction as to input for our need for input, public input for the strategic plan. There are two different links here. This first one will take you to the draft strategic plan goals and actions. And then this next one will be the feedback form itself. So if you click on the draft strategic plan goals and actions, it will take you to a draft form of the goal itself, or sorry, of the strategic plan itself. Here you can see all of the different pillars, the different goals that we just reviewed, and the different actions that are currently under those goals. I do want to mention that those actions are not exhaustive steps that we want to take for reaching those goals. These are just actions that have been identified, and if you have actions that you feel need to be included underneath these goals, that is something really wonderful to add in to that public input form. From there, you can go ahead and put the feedback survey, click that feedback survey. It will take you to a Qualtrics link. The Qualtrics link will allow you to provide feedback for the survey. I think it has taken me to back to where I was. So give me one moment and I will show you another view. Google's just being too efficient and taking me right back where I left off on the survey. All right, so when you navigate to that survey page, this is what you will see. So it will ask about some very general feedback of the strategic plan itself, asking if you agree with the general direction, saying if you need to provide any questions overall, and then it will ask if you would like to continue to give specific feedback. And I will show you what this looks like if you want to give feedback on this first goal. So it will give you the opportunity to provide feedback for each of the goals. So the ecosystem goal 1, you can indicate your agreement with each of the actions, asking if there's any different words you would use, any concepts we're missing, any recommendations for how you, your community, or state should implement these strategies. And then any other general thoughts. And then you have the opportunity to say, yes, I would like to continue giving feedback that will take you to goal 2 of pillar 1. And you can continue to do this process through the entirety of the plan, or you can say, I'm done, and take me to the end of the survey. And that will provide you with the ability to get out of the survey once you feel like you have already provided all of the feedback that you need. As I navigate back to our PowerPoint for today, does anyone have any questions concerning how to get to or access that survey to provide public feedback for the strategic plan? All right, so as it says on the slide, that feedback form is open now and will be open until April 19th. So please, if you have any thoughts on the current plan, we would love to hear them. And if you have anyone that you feel like needs to be reviewing this information, please feel free to send that their way. This is open to any and all individuals, parents as well, families as well, within that early childhood ecosystem. There are a couple small group feedback sessions coming up. So there's specifically for families, family leaders, and members of the Family Advisory Council. The first one will be on Saturday, April 13th at 12 p.m. And the next one will be Wednesday, April 17th at 6:30 p.m. So if you have families that you would like to have an introduction to the plan itself, please send that information their way so that they can register to be part of those small group feedback sessions. Our next steps from here, as we said, was the public forum, form available on the Children's Cabinet website. We are doing additional small group sessions, and then you will also see the information to access that public feedback form on the All In for Kansas Kids newsletter. From there, we will go on to early childhood system updates, unless anyone has any thoughts or questions. So I will pause for a couple moments. Not seeing or hearing any thoughts or questions, we will move ahead. So we have some early childhood resource coming up, the Stellar Insights Early Childhood Data webinar series. The topic is Every Child Counts, an Introduction to Data Resources. Speaker will be Monica Murnan from Greenbush Education Center on Thursday, March 28th from 10 to 11. This is designed for early childhood service professionals, raising awareness of existing data tools, how to use them, why to use them, and how collaborating around data can help us get to a place where every child thrives. Don't miss the opportunity to engage in a meaningful discussion and learn how to advance your data-driven practices. Next is the Kansas Fights Addiction Community Futures Tour. So this is the Kansas Fights Addiction Needs Assessment. This needs assessment, United to Transform, invites all Kansans to participate in their upcoming Community Futures Tours. There will be a discussion as to explore multiple future possibilities for communities, organizations, and families related to substance use disorder experiences in Kansas. Any insights will contribute to guiding futures-focused opportunities and innovation for innovation and resilience amidst change. And you can see the United to Transform schedule there. Accelerator news. So the Child Care Accelerator. The Manhattan Community Foundation has a job opening. The Manhattan Community Foundation is looking for an executive director. An exciting development for the Child Care Capacity Grantee is looking to hire for their future acceleration work is a dual titled position, which would be Executive Director of Childcare Business and Accelerator and Director of Flint Hills Community Accelerator. So if you are looking for, looking to get involved in a leadership role, please reach out to the Manhattan Community Foundation. Next, grants and funding. The Nita M. Lowry 21st Century Community Learning Centers Grant Competition. So KSDE is conducting a 2024 Kansas 21st Century Community Learning Centers Grant Competition. This is intended for programs to create community learning centers that provide academic and enrichment opportunities for children for outside of the regular school day. In order to qualify, they must meet the following absolute priorities. The grant will primarily serve children who attend schools eligible for Title I school-wide programs. Title I school-wide programs designation typically means that at least 40% of the students qualify to receive free or reduced cost meals. So if you are looking for more information or wanting to apply, please navigate there. The Child Care Provider Coalition of Kansas is offering a professional development event throughout the month of April. So this is the CCPC Play Academy. And it is 8 KDHE approved work hours, variety of workshops, interactive Facebook event, online workshop discussions, and giveaways. So if you are looking for professional development opportunities, that may be for you. And then we have on March 20th, our family leadership team mixer. So join us for interactive sessions to realign the family leadership team, discussions of actionable solutions, and re-engage increased memberships. So save the date for that. And that is part of the All In for Kansas Kids initiative. Upcoming early childhood conferences, we have Camp GWC, Early Childhood Annual Conference, virtual on April 12th and in person in Wichita on April 13th, featuring a variety of workshops, keynote speakers, networking opportunities to enhance knowledge and skills of those working with children. And then on April 20th in Fort Scott, Kansas, the Southeast Kansas Child Care Conference to elevate early childhood professionals, keynote speakers, and participants get to choose morning and afternoon breakout sessions to attend. And this is worth 6 KDHE in service clock hours. So if you, again, are looking for more professional development opportunities, there is the opportunity there to register. So as always, a reminder on our next step, the next early childhood recommendations panel is on Friday, March 22nd from 9 a.m. to 11:30 a.m. Those are available on the Cabinet the Cabinet YouTube channel to be able to view, as well as the next Children's Cabinet meeting, which is April 5th from 9 a.m. to 12 p.m. Our next webinar, our next version, iteration of this webinar will be April 10th, as always, from 12 to 1. And you can find all of these meetings on the Children's Cabinet YouTube channel. And that is all we have for you all today. I'm more than happy to stick around and answer any questions that anyone has in terms of the resources that were shared or the strategic plan itself.